Joining us now, NBC News medical contributor, Dr. Vin Gupta. Dr. Gupta, I'll let you just kind of take what you heard there from the Florida Surgeon General and as a physician address some of the points he made there, also keeping in mind the context of the state of Florida, the age of many of the residents there and their vulnerability if disease does in fact spread out into the community.
Well, good morning. First I'll note for your audience that vaccine exemptions for non-medical reasons in the state of Florida have already existed. And they're increasing. So what he did yesterday was performative. It wasn't substantive, but it's going to put gasoline on this problem that is getting worse. And why does this matter? For your communities across Florida, but frankly across the country, are seeing exemptions for, say, the polio vaccine, Willie, that are lowering coverage for communities to say 92%. Why does that matter? That matters because that's the threshold below which outbreaks start to happen. We talked so much about herd immunity during COVID. You need that for any infectious disease. And so the more people opt out, or now in this case are not required to do basic childhood vaccines, outbreaks are more likely. And the problem is this isn't just focusing, or the people that are impacted by this are not just kids that decide because their parents decide they don't get vaccinated. No, it's any child in the state of Florida, because we know, for example, diphtheria, pertussis, tetanus, that's a 3-shot. There's 3 shots in one, Tdap. We need 5 of those shots when we're younger to have a full series. And that last shot, Willie's between 4 and 6 years of age. So you're going to have kids that are not fully vaccinated, going to school with more and more kids that are unvaccinated, being potentially at risk of testing positive, bringing that back home into a multi-generational household, exposing folks. And so nobody wants that. I'll lastly say here, just on the tee-up, 80% of Americans support these vaccine mandates for kids, requirements to enter a daycare, a school-type setting. This is not controversial across the United States. This is not political. 80% of kids, based on multiple recent polls. So I know we had some folks chanting and applauding, but anybody can curate an audience at scale. No one wants this.
So, Dr. Gupta, when you listen to what we heard there from the Florida Surgeon General, and a lot of what we've heard from Bobby Kennedy Jr., just amplified now because of the position he finds himself in, all this skepticism about vaccines, now packing that panel at Health and Human Services with vaccine skeptics. Can you just address, let's just take these basic vaccines that kids have been taking for generations to go to school. Are there questions around them? Do they make people sick? Have they been making children sick? Is there reason for concern? And if so, why hasn't that been addressed in the, 80 years since they've been around?
I mean, Willie, you're signaling it. No, the answer is no. There's no scientific evidence that any of the childhood vaccinations, let's take tetanus, measles, mumps, and rubella, polio vaccine. I mean, these are just fundamental, foundational things that no other country in the entire world, by the way, is having a similar type of discussion at their governmental level. We are, because of the people that are currently in power, but there is no reason why the other countries across the globe are having a similar discussion, because the science doesn't beg it. There's no incidence of increased side effects. There's no links to autism. This is one man with his agenda and the power to really enact his agenda. That's RFK Jr. I'll lastly say here, just on this topic of why this matters to American families across the spectrum, because Florida is likely just the canary in the coal mine there. We're probably going to see this in more states across the country. Just like we saw here on the West Coast, that they're banding together to create their own coalition to counter the CDC, we're going to see this likely happen in more places. For everybody out there, something that has happened since 2008, Willie, is that pediatric beds across the country have declined. 20% decrease in pediatric bed capacity in children's hospitals across the country. Why does that matter? Just at the time that Ladapo and DeSantis are doing this in Florida, creating more burden of illness for kids, there's less beds to actually deal with the aftermath. And we saw in West Texas, when you have a measles epidemic, that lands kids in the hospital that need supplemental oxygen, likely in an ICU. We have less of those beds, Willie.
So the message from the top here is consistent. Dr. Mehmet Oz, who President Trump picked to serve as the administrator of the Centers for Medicare and Medicaid Services, was asked yesterday on Fox News whether there should be vaccine mandates. Here's what he said.
I would definitely not have mandates for vaccinations. This is a decision that a physician and a patient should be making together. The parents love their kids more than anybody else. I could love that kid, so why not let the parents play an active role in this? There are some states now where you're seeing an increase in homeschooling because parents are running from the healthcare system. They can't get healthcare because doctors are unwilling to take the risk of taking care of children who don't want vaccinations because it might impact the way their practices are run. They shouldn't feel pressure from the government to decide what to do with the vaccination schedule. They should do what's the best interest of the person in front of them, let's say it's a child, and what those parents desire.
Dr. Gupta, your reaction to that?
It was hard to follow. That was sort of gibberish from what I could tell, but I wasn't following Dr. Oz's rationale there. I have not seen, nobody is seeing this. I work closely with the American Academy of Pediatrics. Across the spectrum, they represent pediatricians across the country in every single zip code, Willie. No one's saying this. If anything, everybody's saying, listen, we're having those conversations. No pediatrician has time to answer 30 questions about a fundamental vaccine because they have other things to do with that baby at a well visit. And so to now put the onus on pediatricians and families to ask all these questions that no one else is asking because there's no scientific reason to ask is them just passing the buck here. For everybody out there, I would ignore what was just said. Again, it was hard to follow. Go to healthychildren.org. healthychildren.org. It's produced by the American Academy of Pediatrics, Willie. It's a nonprofit. It has clear, navigable information. You can't trust what's coming out of this government right now at the very top. Go to healthychildren.org for information, clear, navigable on childhood vaccines. But Willie, there's no reason for this.
NBC News medical contributor Dr. Vin Gupta, thank you very much. That is sad that we can't trust, but we can. Coming up, we'll dig into new reporting on the Trump